You left your computer screen unlocked when you walked away, you threw a report sheet in the trash, or you shared a diagnosis of a patient in the elevator. Those are all HIPAA violations, and you could lose your license. So let's talk about this and how you can avoid these types of things.
In this lesson, we're going to take a look at HIPAA, the Health Insurance Portability and Accountability Act, and see how it affects our practice. So we hear about HIPAA all the time. Well, what exactly is HIPAA? Well, the HIPAA is the Health Insurance Portability and Accountability Act. And what it is it's a federal law, and it focuses on patient privacy. More importantly, it focuses on something called PHI, which is Protected Health Information. It outlines who, what, where, when, why, and how we can use the information. The big thing here is that it's all about privacy. So lab tests, diagnosis, medical history, you name it, it all falls under this PHI. And you don't discuss that PHI unless it involves someone who is on what we call a need-to-know basis, which I'm going to talk about in just 1 second.
Hope is not a strategy. You either know you're going to pass or you think and hope that you are. NCLEX simulates the NCLEX for you, and your NCLEX Ready Score tells you if you are ready to take the NCLEX and pass right now. Head over to nursing.com to get your nursing survival package and NCLEX Ready Score now.
So when we talk about patient privacy, we want to know what that looks like. So when we say patient privacy, we're actually talking about PHI. So anything about that patient. So we're talking about lab tests and any previous diagnosis or any previous surgeries. They all fall under PHI. As nurses, we need to know who we discuss that with. So when we talk about need to know and we talked about actively involved, what does that look like? So if you want to talk to your charge nurse about developing a plan of care for your patient, you can do that because your charge nurse is actively involved with your patient. The person you can't do that with is your nurse friend at the other hospital down the street. That violates PHI. Which kind of leads me to my next point. So who else can you share it with? Well, let's say you have a family friend come by and they want to check on your patient. Well, the thing you have to do is get the patient's permission to disclose that information. Sometimes they're okay with it, sometimes they're not, but you always need to ask. The other thing that I want to touch on real quick is phone calls. Commonly, you'll get a phone call to check on a patient and ask for, get a patient update. What you need to do is err on the side of caution because you can't identify, you can't know with certainty the other person on the other end of that phone call. They say you're the patient's mom, but you don't know that. So the best way to approach this is to err on the side of caution and say something like, I'm sorry, but I can't give any information over the phone. If you want, you could talk to the family for updates. The best thing to do is check with your unit or hospital policy, and they're going to be the ones to specifically tell you how to handle those types of situations. Now we're going to talk about something we call PHI pitfalls. So these are situations where you would consider yourself quote unquote safe, but you're really not. First off, you always need to turn your screen off or away from onlookers and make sure you log out if you walk away. The new diagnosis for the patient of HIV and the family friend who happens to peer over your shoulder puts you at risk of liability. So make sure you're always logging off or turning your screen off when you walk away. If you are not physically at your computer, log out. You'd be surprised at how intuitive computer software is, and people can just navigate it and find a family member or some other patient's record, and you don't want to do that. Another point is that you don't want to talk in public places about your patient and their information. You have no idea who's within earshot. Elevators are a common place that this happens. You get off the elevator, that family member happens to be there, just don't do it. You want to make sure that when you are discussing information, you do it in a private area away from unsuspecting people. The other thing is shredding PHI. EKG strips, report sheets, the new labs that you just got, whatever it is, unless it's required to be in the patient's chart and it's something that you're writing on, you need to shred it unless it's specifically mandated by the unit or the hospital to actually maintain a copy of it within the chart, it needs to be shredded. You don't want to lose the information. You don't want it to be available to somebody else. The last thing we want to talk about is social media. If you are tempted to post something about your patient on social media accounts, don't do it. Just don't. So, speaking of HIPAA violations, let's look at them. So we want to look who's affected. So obviously, when there's a HIPAA violation, the patient is affected. But another thing to consider is that the hospital is affected, and all the healthcare workers that were involved with the violation are also affected. But HIPAA always also affects healthcare workers. So it's not just nurses it affects. So meaning that respiratory therapists, registered dietitians, your patient care techs, your CNAs, everybody that is privy to the information also has a right and responsibility to protect the private health information. The question then becomes, what happens if I violate HIPAA? Well, you could be suspended. You could be fired. You could lose your license. You could be fined. You could face a civil lawsuit. You could face criminal charges, or you can face all of this stuff. It's not just that you'll get one little tiny slap on the wrist. It's that you could actually lose your career and all that you're working for now. So don't share private info about your patient. It is a federal law. HIPAA is a big deal when we talk about nursing concepts. It affects our ethical and legal practice. It's a direct result of healthcare policy, and it is a professional responsibility as a nurse. HIPAA is no joke. So let's recap on some key points about HIPAA. Remember, it's a federal law, and it protects the information, the health information of patients, and it is private. Always do everything in your power to protect your patient's information. So shred papers if you're not required to be a part of a chart. Don't talk to people that don't need to know about the patient, and don't post on social media. Also, don't share in public places. Lastly, you could lose your job, lose your license, and be sued. So be smart with patient information. If there is one thing to remember from today, protect your patient's information. Be sure to check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.
Look, PowerPoints won't save you, professors won't save you, and that sinking feeling you're feeling in your gut right now, that's real. Nursing.com is the reason over 300,000 nursing students have gone on to pass the NCLEX and become practicing nurses. Get your nursing survival plan over at nursing.com right now.